Recibamos a continuación, como no, con plena atención, a Fabrizio Didonna.
It's a big honor, it's a great honor and pleasure to be here today. And first I would like to thank the many people who made this event possible. And in particular, I would like to give my heartfelt thanks to Mr. Aurelio Lopez for the wonderful work he does every day to alleviate the suffering of so many people affected by OCD. So thank you so much to him. Also thanks to the many colleagues, the wonderful colleagues of the Asociación TOC Granada for their incredible work and also for their helpful assistance to me. And so today I just would like to introduce the therapeutic model I developed over the last 20 years that integrates the most effective elements of the cognitive behavioral therapy and the principles, the practices of mindfulness and compassion for a really challenging problem that you know very well, obsessive-compulsive disorder. So let's get started, maybe. Yeah. So this is the human brain, you know. Human brain is the most powerful, complex, and also useful result of the human evolution in over 3 million years. This is a good news. The bad news is that no one teaches us when we are children how is the best use to do with these complex tools. So how to use this tool in order to create well-being and to overcome all kinds of suffering. This is, of course, has to do a lot with the issues and topics that I'm going to address in this presentation, in particular with the mindfulness-based approach for OCD. And there is a very nice quote from American novelist, which is called Mark Twain, that summarizes very well the life of people affected by OCD, when he says that there has been much tragedy in my life. At least half of it actually happened. So this is the result when you live constantly in the future or in the past, in a bad way, of course. So this is one of the reasons because it is important to find ways to be deeply in touch with the present moment. As you already know, OCD is an extremely heterogeneous disorder because there are so many different symptoms that characterize this problem. So there are people with a problem of control, people with a problem of cleaning, people with problem of order. There are also people with a pure obsessive, so obsessiones, obsessions without compulsions, without overt compulsions, and also people with the problem of hoarding, so they need to collect many objects, you know, of people with an obsessive-compulsive personality disorder. So people without overt compulsions and obsessions, but with the very rigid rules about the life, about how he need to perform everything. And also, there is a problem with people with problem of deep belief about religion or magical thinking. Also, there are people with obsession focused on the relationship, an affective relationship. So there are so many different forms of OCD, and when we try to project a therapeutic model that can be effective for all these different forms of OCD, you need first to understand what are the common features of these different forms of OCD. So you don't have to target so much the symptoms that are different, but the common factors. That's why I try to understand what could be the common factors in OCD. I'm sorry, but I have to manage the Spanish version and the English version. Okay. So this is the question that I asked myself for many years. What can be the common factors that are transversal to the different forms of OCD? The first, they are all very general factors, not symptomatic factors. And the first factor is an extreme difficulty to accept. So it's a big problem with acceptance, an extreme difficulty to accept normal and harmless experience, internal experiences. And when I talk about internal experience, I mean thoughts, emotions, and physical sensations. Another common factor is this is quite connected with acceptance, is the difficult to prevent or delay a reaction to internal stimuli, so in particular to intrusive thoughts. And there is a wonderful quote, a Buddhist equation is very famous, that say that suffering is equal pain times resistance, you know? So the more you resist to pain, the more you increase pain and create suffering. So suffering is a form of expanded or extreme pain that is created by our tendency to react, to resist to normal pain. And the tendencies that people affected by OCD have is to continuously react and resist to normal and harmless internal experience, so thoughts, emotions, and physical sensations. And when you continuously react to these internal harmless events, you increase pain, you increase the disease, and you create a form of suffering. So OCD is a particular form of suffering. That's why we would see that in an MCT for OCD program, we try to help people to develop acceptance, to develop a non-reacting attitude to internal experience. Another common factor is what I call the overactivation of the self-protective system. The evolution of human brain created, in particular, three main effector regulator systems in the brain that are able to regulate and to activate in an adaptive way our behavior, our feelings, our emotions, you know. The first affector regulator system is the threat system, the self-protective system, which is designed to protect ourselves from all kind of dangers we can find, all the threats that we can find, real dangers, but also imagined dangers. You know, the problem for humans is that we don't deal with just the real dangers, but also with imaginary dangers. And this system activates in us all the defensive emotions that we have. So, for example, anxiety, anger, and disgust, you know? Another important system is the drive system that drive us in order to use our energy to achieve our goals in life. So in this moment, probably the drive system is active because I'm committed to explain something to you. Another system is the soothing system, which is active when you feel safe, when you feel satisfied from a need, or when you feel that someone is taking care for you, is caring for you, you know. And this is a system. This is a system that is the opposite system of the threat system, you know. So they are antithetic systems. When the soothing system is active, the threat system is the deactivated, you know. So this is important to know because when a psychological treatment is effective, we know that the soothing system is more active of course, in harmless situations, and the threat system is deactivated, in general, of course. So we need to find ways to help our brain to activate more the soothing system and to deactivate the threat system in a harmless situation, okay? The problem in OCD is that the threat system is overactive, is a constant alarm, and so people need to react in order to defend themselves to a possible danger. But of course, you know that this danger is not real, but the brain don't know that, okay? So, all these systems are interdependent and interact continuously each other. And we will see how mindfulness and compassion-based approach can help in this way. So it can help to activate more the soothing system and deactivate the threat system. Another common factor that I think is very, very a key common factor is a feeling of self-mistrust. In fact, I noted that people affected by OCD, has a specific or sometimes general cognitive distrust toward their own private experience, in particular toward the three basic functions of consciousness. that are, first is distrust in perception. So very often people affected by OCD have difficulty to trust about what their senses communicate to them. And if you are not able to trust your senses, you have so many doubts about everything, because our senses are the most important tools we have to stay in touch with reality. But if you don't use the information coming from the senses, you can have doubt about everything. Another problem is another form of mistrust is about memory. So very often people affected by OCD do not trust about their memory. They have a very good memory, we know that by research, but they do not trust the information stored in the memory. So if you are not able to trust of what you memorize in your brain, of course you can have many doubts about everything. So the problem is not a deficit of memory. The problem is that you need to trust your memory, okay? Another form of mistrust is about intention. About intention. This is not true for all kind of OCD, but is true, for example, for people who have a fear to do something very bad, for example, to kill someone, to rape someone. So very, very bad things that are the total opposite to our real intentions, you know. So the problem here is that if you don't validate, if you don't give value to your intention, you can have a fear to do everything bad, of course, because you don't use the awareness of your intention, your real intention. And you know that all people affected by OCD have no bad intentions, you know that. But you need to validate your intention in order to use your intention in guiding your actions moment by moment. So that's the reason because I conceptualize OCD as a trust disorder, you know. So we need to work a lot in therapy in order to increase the level of self-trust if you want to have an improvement in OCD. There is a wonderful quote by Frank Crane, is an American journalist and novelist, who say, you may be deceived if you trust too much, but you will live in torment if you don't trust enough. And this is the life of the people affected by OCD. So, what is effective for OCD? You already know, and also David Vail will explain to you very well later that the cognitive behavioral therapy is the gold standard for this kind of problem. There is a lot of research that demonstrates the effectiveness of this therapeutic model. In particular, when you use exposure and response prevention, we know that we have some rate of more than 75% of people who can improve with this kind of treatment. We also know that pharmacotherapy is an effective treatment. You know that about 40–60% of patients improve with this medication, in particular when you use serotonergic antidepressants. But there is a but. We know that even though CBT is very effective, we know that, there are many people that do not benefit so much from this kind of treatment, in particular because the highly anxiety-evoking effect of exposure and response prevention. So some people retire, some people drop out from therapy because it's too much anxiety. Or people who are difficulty to engage with homework, or people that have not overt rituals, but just internal rituals, mental rituals, and so on. So, over many, many years of work with OCD, I wonder this question: what we can, what therapeutic means, techniques, and approaches, and skills do we still have that could improve and strengthen or be effectively integrated with the already established treatment, so with CBT, in order to increase the level of effectiveness for this kind of problem. So what we can do for the people who do not benefit so much from CBT. And as you can imagine, the answer is that mindfulness can be this possibility, this kind of integration. Why we can do that? We can start from a very popular definition of mindfulness by John Kabat-Zinn, who said that mindfulness is the awareness that emerges through paying attention on purpose in the present moment, and non-judgmentally to the unfolding of experience moment by moment. So you can see in this definition that this definition highlights something that is quite difficult for people affected by OCD, because for people with this problem, it's sometimes difficult to pay attention on purpose, intentionally, to what is not connected with their problem, for example, because in OCD there is a form of a selective attention, the selective attention toward the obsessive stimuli. For people affected by OCD, it's very difficult to stay in the present moment. In fact, they are very, very often with the mind in the future. What could I do if I don't prevent this? Or in the past, what can I have done in just 1 hour ago or yesterday, And so it's difficult to stay in the present moment. And then non-judgmentally means that if you have a thought, you can just observe it without judgment. And it's difficult sometimes because people with this problem tend to judge continuously their thoughts, their emotions, themselves, And this is one of the factors that increase the problem, create disturbing emotions, and enter them into a pathological process. So, mindfulness can be conceptualized as the antithesis of many obsessive mechanisms and phenomena. And in this sense, OCD can be seen as a severe state of mindlessness. Mindlessness is the opposite concept of mindfulness. So, as absence of awareness, in order to demonstrate this issue, we implemented a research study some years ago in which we wanted to see if people affected by OCD, not only people affected by OCD, but also people affected by other disorders, so with the people with depression and people with borderline personality disorder, we tried to discover if they have a lower level of mindfulness skills compared to people, non-clinical samples, so people that are not affected by a disorder. And what we see, what we have seen in this study is that all the three clinical samples, so people affected by OCD, depression, and borderline personality disorder, had a significant lower level of mindfulness skills compared with the non-clinical sample. This is an important issue because if you want to show that mindfulness can be effective for OCD, we have to see that people affected with OCD have normally a lower level of mindfulness skills. So if you are able to increase these skills, we can say that we have an improvement in OCD symptom, we can say that probably mindfulness can be the mediator of the clinical change. And this is what we have seen in another study that I'll show you later. There is a wonderful Buddhist quote that explains very, very clearly. It's a quote. It's taken from Anguttara Nikaya, which is a Buddhist text of 2,500 years ago, that says that not through actions, not through words, do we become free from mental contamination, but seeing and acknowledging them over and over. So, translating this quote in terms of OCD, we can say that not through rituals, not through reassurances, nor verbal compulsions do we become free from obsessions, but just observing those thoughts at a distance and without reaction, you know. So in this quote, we can find the essence of effective treatment for obsessive problem. And it was very inspiring for me. So I told you at the beginning that we have to find ways to train our mind in order to create a well-being and not suffering. So in order to do that, we have to develop a different relationship with the contents of the mind. And we can start from some basic issues that probably many people do not consider in their normal life. The first issue is that thoughts arise unbidden in our minds. So we don't have to control thoughts. We don't have to do anything to thoughts when they happen, because we have no control to them. We can have control just to what we can do after thoughts happened. This is an important issue, in particular when you use mindfulness for OCD, that you can just observe the thoughts that happen spontaneously, and then you can decide what do you want to do after the thought appears. And another issue is that we are not our thoughts. So this is the principle of disidentification. That means that I'm not what I thought, what I think. I'm not my thoughts. My thought doesn't say nothing special about me, because thoughts are created for different criteria, and they don't say nothing about me. And this is really important, because very often people affected by OCD tend to identify with their thoughts. So if I have this thought, it means that I am a bad person, for example. If I think this, it means that I could do something bad, you know. There is an identification. And as we will see in mindfulness, we learn to disidentify from our thoughts. And another point is that all internal states are by nature totally harmless, even though we feel them unpleasant. So there is no reason to fight, to resist, to react to internal experience, because it's totally harmless. But this is exactly what people affected by OCD tend to do. They react to totally harmless experience, and in this way, they create a really harmful problem. You know, this is the big paradox, the big OCD paradox. But we can learn to stand back from our thoughts and just observe them from a distance without reaction. We can learn this attitude. We can learn this attitude training the mind, in particular with mindfulness training. And when you are able to stand back from your internal experience, this can modify your relationship with it. And finally, eventually, it can release from suffering. So, MCT for OCD can be seen as a comprehensive approach to obsessive problem. It is an intervention, is an approach that is not focused on the specific symptoms of the problem, but to the general systems of the individual. And so the general attitude we have with internal experience, thoughts, emotions, and physical sensation, but also with external experience, what our senses say to us. And this is really important. So, to sum up, why MBCT for OCD can be helpful for obsessive problems? We know now by research that mindfulness, in particular MBCT for OCD, is helpful as an anti-ruminative and anti-avoidant attitude, because when you are able to observe internal experience without reaction, we prevent avoidance, all the forms of avoidances that we can find in OCD, you know. And we also stop or prevent rumination, because you are able to just observe thoughts without caught up and engaging in the thoughts. And another important issue is that through mindfulness we can learn to self-regulate our attentions. So we can have a more adaptive attention to the environment, not just a selective attention like is in OCD. Through mindfulness, we can also learn some really important skills, therapeutic skills, such as the centering, the fusion, this identification. This is what I told you before, you know. And furthermore, we know that through mindfulness training and also compassion training, we can prevent useless activation of the self-protective system, and we can have a more adaptive and functional activation of the soothing system. This is what I told you before. Another important key issue is that through mindfulness training, we can develop a deep acceptance of internal experience and also a self-validation of internal states, you know, self-validation of our thoughts, our intentions, our emotions, our feelings, you know. This is really important. In particular, self-validate what our senses communicate to us. And finally, but not final, is MBCT for OCD can help people to develop a real self-trust. It is, in my opinion, in my experience, one of the most important issues in treating obsessive-compulsive disorder. So let me explain something about this model. This is an 8-session therapeutic program. 8-session therapeutic program. It is not so long program, but it is very intensive because there is a lot of practice, session by session. And this program integrates in particular 4 areas, scientific and cultural areas. The first area is evolutionary psychology. Evolutionary psychology helps us to understand basically that obsessive-compulsive symptoms, so compulsions, seeking reassurance, are all basically normal defensive behaviors, and that you can find in the human evolution, and you can also find in primates, in monks. In a particular research, we see that monks in a particular situation can activate the same rituals that we can have in OCD. I also show to my colleagues in my training, you know, that we can create obsessions in people that are not affected by OCD, you know, in particular situation. So it is not so. It's not so pathological. It is a very important issue in order to normalize the obsessive problems. This is one of the key features of MBCT for OCD. Normalize your experience. And when you are able to normalize it, you are able to understand it, and you are more able to develop a different approach toward experience. Another important area is neurobiology, and in several years I tried to understand how mindfulness can affect our brain in an adaptive way, in a functional way, and I also try to understand if mindfulness can intervene toward the same areas that are affected, brain areas that are affected in OCD. And what I have seen in my research is that you know, when OCD is active, there are some specific area in the brain cortex that are overactive or underactive. You know, I don't want to complicate you, but you know, there is in particular the limbic area, in particular amygdala, that is overactive, and the area in the medial prefrontal cortex that are underactive in OCD. Neurobiological studies show that through mindfulness training, we can activate the same area that are involved in OCD in an adaptive way, in a functional way. So mindfulness is able to activate the area in the medial prefrontal cortex that are underactivated, and to underactivate the area in the amygdala that is overactive in OCD. So this is a really important finding because we see that through mindfulness, actually we can change the brain. There is an important phenomena in neurobiology is called neuroplasticity. That means that if you train your mind, you can change your brain. You can change the circuits in your brain in a more adaptive way. There is a wonderful Buddhist quote that says that what you practice grows stronger. So if you tend to practice a mental habit over and over again for years, this mental habit become a specific circuit in your brain. But in the same way, if you train your mind in a different direction, in an adaptive, in a functional direction, you can create new brain circuits. And this is exactly what the neurobiology research demonstrated to us. And how we can try to do that with the MBCT for OCD. We try to do that, of course, through an intensive mindfulness training. Also introducing new healthy habits in the life of people affected by OCD. Because of the problem, many people affected by OCD have very bad habits, many avoidance in the life. And this is also important as well. And also, of course, through a cognitive training, in particular, we use many guided imagery exercises that can create cognitive changes. And also through mindful exposure. That is an integration between the classical ERP, exposure and response prevention, and the attitudes, the principles, and the practices of mindfulness. And this is a really important integration because we saw that people affected by OCD can learn a new way to relate to the anxiety-evoking stimuli in this way that is less challenging, less anxiety-evoking, because they learn to expose themselves to the stimuli as they are, not as their mind make them see them, you know. So this is a more important issue. We have to learn ways to relate to reality as it is, not as the mind tend to modify the reality. Another key intervention in this program is a self-compassion training. And we will see later how self-compassion is important to intervene toward some basic cognitive processes that is crucial in OCD, and also to work with emotions and feelings. It is very difficult sometimes for people affected by OCD to work at this level, not in this level, you know. Another issue that we do in the final part of the program is helping people to take mindful risks in their life. Taking risks is probably one of the most powerful things that you can do in order to develop trust, self-trust. And people affected by OCD have very often difficulties to take risks because of the problem of responsibility and for other problems connected with OCD. So we help people to take mindful risks. That means risks that are not dangerous for them, of course, but they are helped to do things that are very helpful for their life in order to open them to life, because the life of people affected by OCD is very close for many, probably for many years. Also, another important issue is that we help people to create healthy intentions in their life, to validate their real intentions and to give value to them and to use them in order to guide their actions in a normal way, in an adaptive way. So these are some things that we do in this program. And okay, the other important area is, of course, cognitive behavioral therapy. It's cognitive behavioral therapy because, of course, MBCT is an integration within CBT and mindfulness. And this is important because there is a cognitive part in the program, but also a behavioral part. For example, mindful exposure or introducing healthy habits in life and many other things. And of course, another field, important field, is Buddhist psychology that give to the program most of the principles, teachings, and also the practices that derive from this important psychology. So, what are the basic features of this program? This program can be delivered in a group format, but also in individual format. And is it possible to deliver in person and virtually, also online? And this is a very important way to deliver the program. In particular, you know, over the last years with the pandemic, it was very difficult to have people in person. And so this was very helpful for us to deliver the program also to people that live very far from our center, also from foreigner people. So it is an important application. The number of the session is 11. We have 9 standard sessions, and 1 session with family members. It is very important to help family members and partners to understand the best way to help people affected by OCD. and also to become a sort of co-therapist with the program. So family members can give an important help for the treatment, for the program, because they are the person who are more in touch with the patients, with the people affected with this disorder. So it is an important psychoeducational session. And also, we have the final session of the program, which is a one-day session. It's a very intensive session that I want to create particular motivation to go on with the practice at the end of the program. Yeah, the duration of each session is about 3 hours in group and 2 hours in an individual session. And the number of participants in the group ranging from 4 to 10. So we don't have large groups. And we use the same exclusion criteria that are normally used in group. So we try to avoid to having group people that can be very difficulties to stay in the sessions, to practice mindfulness. But in general, there are not so many contraindications. So most people can enter in this program. What are the key issues, the key features of MBCT for OCD program? A key issue is understanding. So the first thing that we do is helping people to understand what mindfulness is, and then to understand how OCD works, and then understand how mindfulness can intervene toward the several mental processes that are active in OCD. This is a very important issue. We start with this issue, understanding. We say in the program, understanding is the first step to heal. That in Italian have the same words. You know, so understanding is a key issue. And a second issue is normalizing. As I told you before, is really important that people affected by OCD are able to normalize their experience, normalize their relationship with thoughts, their relationship with emotions, and with the bodily sensation, their relationship with senses. So this is an important key issue. There is a quite funny coincidence. You know, you probably already know the famous novel, by famous novel Don Quixote de la Mancha, you know. We can call el TOC Quixote de la Mancha, because as Don Quixote was firmly convinced that some normal windmills are actually giants, terrible giants that want to kill them. So when he had this conviction, he had to fight them together with the assistant Sancho Panza. And because he was convinced that the windmills are giants. And so it is not so different from what you find in OCD, that you think that you have several giants in your life to fight, to resist. But actually, they are and remain just windmills, you know. So we say to patients, there is no need to fight or escape from what is, without a doubt, harmless. This is an important message. And another important learning that patients have in this program is about the real nature of thoughts. So people need to understand what are thoughts really from as a phenomena, you know, and we help people to deeply understand that all the thoughts are just electrochemical reaction or electric micro-impulse or signal in the brain, or a wisp of energy in the brain, or just a synapsis, so it's just a connection between neurons, you know, in the brain. So I think this is a very, it can give you a deep sense of freedom to know that all our thoughts are just that, are just micro impulse in the brain, not anything else. Even though they can be dressed by particular contents on forms, they are just micro impulse in the brain. And we also say to patients that, for example, in order to normalize their relationship with thoughts, that all the thoughts has three features that starts with the letter I, you know. So we say that to them that thoughts are always insubstantiales, so harmless, intangible, inconsistent, and harmless, so innocuous, and also impermanent. And this is true for all thoughts, no one excluded, you know. And this is a very liberatory understanding. If you are able to bear in mind that every time you have a disturbing thought in your mind. We also say we also help people affected by OCD to understand, to deeply understand that from a functional point of view, you have to understand that our mind do not create thoughts to create harm to us, to damage us. Because if it were true, we are already disappear from this planet, you know. So our mind creates so many thoughts a day in order to help us to create the best adaptation to our environment. This is an important issue to understand. Our mind is not our enemy. Our mind is, as I've told you before, is the most helpful tool that we have. But we just have to use it in the best way. We have to learn ways to use it in a more functional way. So we say to patients that you can see all thoughts just as useful. All thoughts can be just useful or useless. You know, they are useful when 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 they are able to help you in achieving your goals, your healthy goals, and or to satisfy your healthy needs. And they are useless when they are just not able to help you in this. So it's very simple. And every time you have a bad thought, you can just think that. Is that thought useful or is useless? Of course, you help people to understand this and to learn this. And another important issue is about the relationship with emotions. So what is an emotion? We help people to understand that an emotion, so anxiety as well, is just a simple combination between thoughts and physical sensations. And both are harmless internal events. And if you combine two harmless events, you have a harmless result, you know, from a mathematical point of view. So this is another important issue. So another important issue is helping people to developing trust, acceptance, and self-validation, as I told you before. And there is a very, very interesting video that I would like to show you, if I have some minutes more, that can show you without words how it's possible to develop acceptance, how it's important to develop acceptance toward our internal experience. And this movie is called The Fly. No. No. Okay. Thank you. So I think now is more clear what I mean with developing acceptance and the centering from your internal experience, and what happens when you tend to react over and over again toward it. We help people to create the best relationship with reality. There is a quote that says, reality is that thing that even when we don't see it or transform it with your mind, it remains exactly what it is. So our goal is to reach the best attitude, the best relationship with the reality as it is. There is also a brief video, but I just some second of the video in which we teach patients affected by OCD this attitude of the validation of the senses. And this is the mindful perception exercise in which people are invited to pay attention to an object in a mindful way, just using a sense. So, for example, sight, hearing, touching, and so on. No, sorry. I can activate the video. Probably you can push. No. Yeah. They are just invited to pay attention in a mindful way using the sight to an object and to validate what their sight-seeing sense say to them. You know, the flower, and then just touching the object and validate what the touching sense say to them. So it is very important to learn ways to stay in touch with your sensorial experience and not with the mind. You know. Okay, we can go home. Yeah. Another important key feature of the program is training, an intensive training in mindfulness and compassion. Compassion is introduced toward the end of the program. Cognitive behavioral intervention is also important. Mindful exposure is also important. And also sharing. In the group format, it is important that many people, probably for the first time, have the opportunity to share their problem with other people with the same problem. And this is a very unique situation for most of them. Just a very brief introduction of the session teams. The teams are 11 teams. Is understanding in the first is understanding how OCD works and how mindfulness can be helpful for OCD. The third session is with family members, as I told you. The fourth session is about trust, understanding their own mistrust and understanding how they can develop trust. And the fifth session is about how to use the senses in order to develop trust. The sixth session is about the relationship with thoughts. This is a very important session. The seventh session is about acceptance. The eighth is about the mindful exposure and mindful intention. The ninth session is about self-compassion and self-forgiveness. And the 10th session is helping people to take risks, mindful risks. And the last session is about dealing with, facing with life with trust and with in an effective way, you know. So these are the 11th session of the program. Just a very brief mention about research. We have now some evidence about the effectiveness of mindfulness and also MBCT for OCD. There are several studies. In particular, we implemented a randomized controlled trial with the University of Shanghai that showed with many patients. We had 120 patients, and we are seeing that after the treatment, the OCD symptoms are significantly decreased, and the outcome has maintained at a 6 months follow-up, you know. In the same way, medication created the same effect, the medication, but of course with MBCT for OCD we don't have the side effects of medication. We also had other effect with respect to depression, so there is a significant decrease of the level of depression at the end, and this outcome is maintained at follow-up, and also with respect to anxiety levels at the end of the treatment. So these are some, finally, these are some pictures from real groups. This is the manual, the official manual of MBCT for OCD. It has been published in English with the Guildford Press. Now we have a Spanish version with the Desclés Brouwer, and the other 5 versions in Italian, Russian, Chinese, German, and French. So it's very, it is translated in many versions. And this is, if you want to have more information about this program, you can look at this, the official website. It is also, there is also a Spanish version. And I just want to finish my presentation with an information for you if you are still skeptical about the use of mindfulness for obsessive problem. I can give you the evidence that actually everybody can learn to meditate, you know. So everybody can learn to meditate, and so you can trust about that. And finally, I want to give you a wish to you all, and this wish is a sentence written in a wall right in here in the Asociación TOC Granada, just upstairs. And this wish say, que ningún pensamiento te ate, que ningún miedo te limite, que ninguna creencia te controle. So, thank you very much. Muchas gracias por su atención.